Today I would like to talk to you about Group 3 study, the impact of the Affordable Health Care Act on healthcare utilization in populations at high risk for cardiovascular disease in the U.S., an NHANES study. Some background on cardiovascular disease, to be abbreviated as CVD for the rest of this presentation. 1 in 4 deaths in the U.S. is due to heart disease, frequently results in needing specialized or ongoing care from a physician, and as a result impacts healthcare utilization. Makes up a significant percentage of healthcare utilization and cost. CVD risk factors include diabetes, which is diagnosed here as fasting blood sugar of greater than 126 milligrams per deciliter, being overweight or obese, having a BMI of greater than 25 kilograms per meter squared, high blood pressure, having a systolic blood pressure of greater than 140 millimeters mercury, diastolic blood pressure of greater than 90 millimeters mercury, or dyslipidemia, such as high density lipids less than 40 milligrams per deciliter, low density lipids of greater than or equal to 160 milligrams per deciliter, triglyceride levels of 200 milligrams per deciliter, or total cholesterol of greater than 200 milligrams per deciliter. Background on the Affordable Health Care Act. The Affordable Care Act, to be called ACA through the rest of this presentation, became law in March of 2010. The goals of this act were to expand healthcare coverage, hold insurance companies accountable, lower healthcare costs, provide more choices to patients, and improve the quality of healthcare for Americans. Our group posed the research question, did the Affordable Care Act change healthcare utilization in high-risk CVD patients? In order to assess this, we found a data source in order to do secondary data analysis. Our data source was the National Health and Nutrition Examination Survey, called NHANES, at the CDC, and also through the rest of this presentation. NHANES conducts surveys and medical examinations to assess the health and nutrition of the U.S. population. It's considered a representative sample, completed every 2 years, and can be used for secondary data analysis. On the NHANES website, which is publicly available, you can access the data that they have available for all the years of the study starting in 1999. And prior to NHANES, there's additional data that can be used but may not be continuous throughout the years that are presented here. So after clicking on a section you would like to review, you'll come to an area where you can select specific variables in each section. Here you see laboratory data is selected, and you see that for each specific section of laboratory data, a data file is available for you to download and use for analysis in any of the studies that you wish to conduct. Important factors that need to be assessed are looking at the definition of the NHANES data, the methodology, and what's changed over the years, all of which is available on their website. So for our study population, we wanted to look at a large portion of chronic disease patients who were previously ineligible for healthcare coverage. So we utilized high-risk CVD patients at 40 years or greater in age. For our pre-Affordable Care Act patients, we used the 2007 to 2008 data set. Those that were analyzed were 2,903 patients. And in the post-Affordable Care Act patients, we wanted to look at those in the 2013 to 2014 data set, giving enough time for implementation of the ACA to be distributed throughout the U.S. population. For the definition of high healthcare utilization, we defined it based on the number of healthcare visits, which is assessed in the NHANES data. Looking at the majority of patients being in either the normal or low user cutoff, we then discovered that high healthcare users would be those who had 4 or more visits per year, and those with less than 4 visits per year would be considered normal or low user of healthcare, allowing us to create a binary variable of yes or no for high healthcare utilization. For our statistical analysis, The association was modeled using multivariate logistic regression, and this was tailored for survey data procedures which have a little bit of idiosyncrasies because of the way data is collected. The primary independent variable, or the exposure variable, was ACA implementation. The covariates used in the model, those that we're wanting to look at or adjust for because of possible confounding, are age, race, ethnicity, gender, and health insurance status. And then, of course, our primary dependent or outcome variable was healthcare utilization. The results of our study found that the variables to be significantly different between pre and post ACA time periods were age, race, multiple of the CVD risk factors, and healthcare utilization. The association between ACA and healthcare utilization showed that patients at high risk of cardiovascular disease are approximately 2.3 times more likely to have high healthcare utilization since the implementation of ACA. The crude and adjusted were almost the same value, with the crude being slightly less and the adjusted being slightly greater association, but very close to 2.3. So, our results showed a positive association between high healthcare utilization and the implementation of the Affordable Care Act. This may be a result of the Act focusing on preventative care and routine screenings. Women were seen to have higher healthcare utilization compared to men, and race was not a significant predictor of healthcare utilization. The strength of this investigation arises from the utilization of a large, diverse, nationally representative sample from the NHANES data. Public health implications. While our investigation used a population at high risk for CVD, this may be extrapolated to those with chronic disease. This could pose a hypothesis that access to care for those with chronic diseases increased because of the Affordable Care Act. Thank you for listening to our presentation. Again, any information regarding NHANES can be looked up on their website if you or anyone else you know is interested in conducting secondary data analysis with variables that would be contained in the NHANES dataset. Thank you very much.